Well, good evening, everyone, and welcome to our health condition workshop on back pain. And my name's Paul,
Good evening. This is Bev.
and we have a special guest with
We
us.
do have a special guest this evening. Dr. Tiffany Hodges, physical therapist, will be with us. Welcome, Tiffany, and welcome back because you have been our presenter before for one of our workshops. So that's great.
Thanks for having me.
Oh, yeah, this
Yeah.
is going to be awesome. So, before we get started, we just want everybody out there to know if you are here for continuing education credits, if you are a nurse, massage therapist, or a doula and you signed up with us, please comment that you're here so that I can take attendance and then I'll send you out your continuing ed credit programs, your evaluations at the after the show. And also, oh yes, you can download the manual.
Yes, go to justtouch.com/workbook and you can download the back pain workbook and follow along with us later when we go into the sets.
Yeah.
That would be great. Yeah.
So we're looking forward. We've already got half a dozen people or so, Tiffany. So we're just going to let you take it away and tell us all about back pain.
Okay. Well, first, I guess I'm going to start by saying it feels kind of weird to not have a mask on right now. Like, I don't know what to do with my mouth. Um, but yeah, so I'm here to talk about back pain. I think so many people have back pain. That's one of the top conditions that I see as a physical therapist. And I guess I'll start with kind of the basic reasons why people end up getting back pain. And a lot of it stems down to core weakness. Um, Core weakness, core instability, and that's not just your lower core, kind of like the abdomen and around the pelvis, but also the upper body. So the shoulder blade region, um, the shoulder blades and the low back, the core, and the glutes, the hip muscles, all help to stabilize the spine. And so if you don't have the strength in those muscles, then your bones cannot be held stable and in position. So that's the first thing to think about. The second thing to think about is how you move. So most people, when they're going about their daily activities, if you look like at a baby, for example, when they're learning to walk and squat, they move perfectly and they kind of like get up, they roll, they start testing their limbs out, crawling. That's how they build stability. And then they finally start getting up to standing and walking. But looking at their squat is a perfect example of how to move, unless they have prior neurological conditions. So then if you look at us as adults, what ends up happening is as you get older, you start imitating the adults around you when you're a child. And that's actually how people learn poor movement habits. So if you look at families, a lot of them move the same way. And then they start thinking, or they're told that, oh, this just runs in our family. This is how we move.
Wow.
But all of that is actually trainable because you didn't move that way all the time. But anyways, so key things with posture are keeping your shoulder blades back and lengthening your spine. So anybody who's listening, if you have low back pain or if you're a practitioner and you're thinking about like what to say to your patients, you can tell them to squeeze the shoulder blades back and down, lengthen the spine like someone's pulling you with a string, and drawing the belly button in towards the spine to engage your core. And that's going to help you to keep your spine stable. And unfortunately, as we get older, there's not just that combination of, oh, I started copying my parents' movements. I started learning from everybody around me subconsciously. There's also the fact that we live in a very forward world. Everything we do is in front of us, which tends to tighten up all these muscles in the front of the chest and the hip flexors especially. And we sit a lot, we drive, we're sitting a lot of the time, unless you're active and you like to go out and run. and walk and yoga and any type of exercise that keeps you moving. I mean, your body heals with movement and your joints lubricate with movement. So it's really important to keep moving throughout the day. But anyways, so what ends up happening is people start getting into this, I'm going to turn sideways, kind of this rounded shoulder position, and the head starts to go forward, because if you were in this position, your head would be stacked over your spine. But as your shoulders start to round, your head doesn't want to end up here. You still have to look at the world. So then the head starts to come up into this curve, so that you can still look forward, even though your spine is starting to round. And then the same thing happens with your hips. So I'm just going to show you hips. A lot of people end up in like a slump like this. It's called a sway back posture, where they kind of let go of the core and they collapse. And then the shoulders round as well. So I'm going to try to squat. I'm tall, sorry. So everything you do, your spine is trying to stack. So if you're here, your head's going to come forward to stack over your pelvis. Some people, their hip flexors are way too tight, so it's pulling the pelvis into this forward tilt. And so they end up standing like this. And even just standing this way, my back already actually hurts because I'm not used to it anymore. But they're stuck in this position. The back muscles get really tight here. The hip flexors are really tight in the front. And so this is kind of a compensation. So in those cases, postures like that, you're going to have to open up the hip flexors to take the pelvis out of this position and back to a more neutral position. And the neutral position has a normal curvature of the spine, with the pubic bone and the ASIS bones, the hip bones in the front. They should actually be stacked. And I'm going to go into a little bit of kind of pelvic floor therapy talk, because I'm a pelvic floor therapist, and that's a huge part of back pain. But your bladder, here's the bladder, your bladder sits right in front of, the bladder sits right behind the pubic bone. So normally when you have a slight forward tilt of the hip bones, and the interesting thing is with the model, it actually looks like you're way more tilted. But this should be in a straight plane right here, and the bladder sits on the pubic bone and is supported. And a lot of people, when their hip flexors are too tight, they actually end up way forward like this. And you don't see this with a person's body because you're not seeing the actual bones. But if you feel them on yourself, you can feel that your hip bones are too far forward in front of your pubic bone, versus somebody in a more rotated backward posture, like a sway back. Their hip bones are too far back and their pubic bone is jutting forwards. So, but you want your organs to actually be in this position, the bladder supported by the pubic bone. If you're too far back, the ligaments of the bladder actually start to get like they're pulling, because they're having to hold your bladder up, and that's not good either. But anyway, so back to postural corrections. So opening up the hip flexors, opening up the chest muscles will help to improve that alignment. And then on the other hand, if the hip flexors are usually really tight because they're way stronger than like your glutes, for example. So you have to combine stretching with strengthening. So stretching the tight muscles in the front, strengthening the weaker muscles in the back, so that you can create balance across the joints. And I mean, unfortunately, since everything we do is so forwards, it's a constant battle, and you're just going to have to keep working on it. So you can go to all different types of therapies, like physical therapy, massage therapy, acupuncture, biotouch, pretty much anything you can think of. There are techniques that people use to help create alignment, to help open up the tissues and relax things. So then the other thing to think about, which is not so much musculoskeletal related, is your organs. So I was just talking about the bladder. So if you think about and picture your abdomen, your intestines kind of fill that whole area. Your intestines have a huge attachment onto the front of the spine. And this is something that most people with back pain, especially low back pain, they don't think about. But if your intestines are too tight, like the ligaments and the fascia, it actually pulls your spine forward. So then you've got this massive intestines. It pulls the lumbar spine forwards and locks it up and compresses the discs. So this actually causes disc herniations and over a long period of time and keeps you in this forward tilt of the spine. And so the things that cause the intestines and other organs to get tight are going to be, one, stress. Any sort of stress, trauma, and that can be emotional trauma or physical trauma. If you think about like the things we say, like, oh, my stomach is tied in knots, like that, those sorts of things, those are actually real. Your gut reacts to every emotion that you have. So if you have a stressful lifestyle, or if you've had prior trauma, like as a child or throughout your adult, or have like had sexual abuse or rape, and I go into those things just from the pelvic floor background, but anything like that can cause your viscera, your organs, to start to tighten and protect and guard. And they actually store emotions too. So if you're stressed out or angry, that's going to go straight to those areas. I mean, it causes your sphincters to contract, and that causes constipation or diarrhea. I mean, it can go both ways depending on the vagus nerve tightness. But, and then.
So we have a question on that.
Mm-hmm.
It says, what kind of symptoms result from the pressure on the bladder in that tipped position?
In the tipped position?
Yeah.
You can have overactive bladder. You can have incontinence from too much pressure on the bladder. More so, it just causes it to get tighter, and you're not going to notice it at first until the imbalance becomes too bad. So if your pelvic floor is tighter on one side more than the other, like the bladder can actually get pulled to one side more than the other, it will cause stress incontinence symptoms. And stress incontinence would be like if you're coughing, jumping, anything more forceful, lifting, laughing. Yeah. Were there any other questions? I love questions. Yes. So then back to the organs, they're hanging. They're actually hanging from your diaphragm by ligaments. And so the intestines kind of hang off the liver, which hangs off the diaphragm. And they're all attached. When you move your spine to turn and bend, your intestines actually slide over each other. There are a whole bunch of loops that are attached to the spine. And those loops are going to slide as you bend forwards and slide as you bend backwards. And so if that fascia is too tight, it's going to lock the intestines up, and your body, you're going to be like, oh, okay, let me bend backwards. Backwards is the usual one people lose, because your front has to open in order for you to bend backwards. So nobody says, oh, my stomach hurts when I bend backwards. Everybody says my back hurts. But really, it's your intestines attached to the front of the spine that are pulling on it. And then your back muscles go, wait, stop, we can't go there. So your spine is complaining and your back muscles end up being the speakers, basically. And the same thing can be applied to the hip flexors. If you look at this pelvis again, this is the vertebrae here. Your pelvic, or your psoas is attached to the front of these lumbar vertebrae and then comes down and attaches to the femur. So if your hip flexors are too tight, they're going to do the same thing as the tight organs. They're going to pull on the spine and cause your back to hurt. That makes sense? Anyway, so any amount of self-massage to the abdomen can help with that. Another thing to think about is hydration in terms of your overall body fascia. If you're not very well hydrated, your fascia actually becomes drier and it starts to stick, gets sticky, and then things start to stick together more. And then back to the question about the bladder too, because this is something I see very often, is with surgical scars. So appendectomies, gallbladder removals, any of those things, hysterectomies, they're going to create scar tissue in the abdomen, which causes the organ fascia to bind more. And because the bladder is right near the appendix anything down in that pelvic area is going to cause more problems, like in terms of incontinence and constipation. And then with the constipation aspect, the more constipated you are, and some people come into the clinic and they'll say, you know, when I have a bowel movement, my back feels so much better. And that's because the ligaments on the intestines are pulling on the spine and the hips and causing that SI joint pain, especially on the left side. Constipation tends to affect the left SI joint more. And then when you have that bowel movement, it takes away the stretch on those intestinal ligaments and it relieves the pain. Or your constipation can be putting pressure on the hip flexor and causing groin pain. It'll refer down the front of the thigh into the groin area, or it'll push on the bladder. If you're too constipated, it can actually be the cause of your incontinence because it's compressing the bladder and making you have to pee. So, and then that brings on another interesting point with the viscera is people that are involved with different sports. So if you think about any sport that's going to involve impact, running, football, basketball, I mean, football, you're getting hit. But anything where you're actually pounding and putting impact through your body, your organs are bouncing. And they don't really like that all the time. Sometimes it's good for digestion because it can stimulate movement. But if there's too much of it over time, it will cause the ligaments to tighten so that they can guard and protect. A big one you can see that in is with gymnasts, ice skaters, figure skaters, dancers that involve spinning. Your organs are spinning inside of you. And they're trying to stay okay. So I see some of the worst visceral tightness with like ex-athletes. And then the tough thing there, and this is another contributor to back pain, is a lot of people are really involved in sports and they're more active during their childhood and up until high school. And then once they graduate high school, they're like, well, it's time to work. And they stop exercising as much and they start sitting. And as well as going to college, a lot of people start sitting more in college. And some people, it doesn't hit them till later because they're still active with sports in college. Whereas other people, they're like, yeah, you know, I'm going to hold off on the sports and I'm going to focus on studying. And as you stop exercising as much, you get that whole tightening of the front. And you're getting weaker because you're not moving as much. And so it starts to cause that pain. So you're going to get the low back pain from the hip flexors. You're going to start getting upper back pain from the chest being too tight because it's pulling the shoulders forward in the socket and causing impingement of the shoulders, as well as that head position I was talking about. If your shoulders round, your head ends up doing this, and you start tightening in the back of the head, which causes headaches and migraines. So as you can see, the entire body is connected. And that's one of the great things about BioTouch. Sherilyn was the one that worked on me a lot, but everything with the way that you guys treat, it's so whole body oriented. So I really like that. And it really helps to open up and relax those tissues. I forgot where I was going with that. But yeah, so everything is connected. And this is why back pain is such a complicated topic and really difficult to treat because it's not coming from just one area. So even if you're just feeling low back pain or you're just having neck pain, you have to look at everything and how it's connected. Another muscle, not just the hip flexors, would be your lats. The lats actually attach to the low back, and they have a huge fascial attachment, like all through your back area. And then they come up and they attach to the shoulder in here, and they internally rotate the shoulder. So a lot of times I see this as people get weaker and tighter, their lats start to try to stabilize the whole spine, but they're not really a spinal stabilizer. And so the tighter the lats get, it locks up your low back and it rotates the shoulders more forward. So you're more likely to go into that sway back posture. But anyways, so that's another way to look at how the shoulders and the hips are so connected. And then another thing I see a lot, because I do pelvic floor, and it's made me look at this much more, is that sometimes your tailbone is out of alignment. And if you think about like a dog wagging its tail, their whole body is wagging, right? And we can't see our tail. But when you move your spine in different directions, your tailbone has to move too. And your tailbone, sorry for the graphic detail, but your tailbone is a key connection point for your pelvic floor muscles. So if the tailbone becomes locked up, it will actually cause your pelvic floor to become more imbalanced, which contributes to more SI joint pain and low back pain. And then if you think about how the entire spine is connected and you have a spinal cord running through with nerves coming out, innervating your entire body, let's say your tailbone is twisted to one side. Well, now the very top of the spine, your head, your skull, and the top of your neck has to compensate. So oftentimes the two will counter rotate. And your spinal cord is hanging down your spine, and it's connected at the sacrum and the tailbone, as well as the first cervical vertebrae and the head, the skull. So if there's a twist at the top, your spinal cord actually twists, and then there becomes a counter twist at the bottom. So in the clinic, I actually see majority of the time, if it's not like a fall related thing, people with headaches and neck pain actually have a tailbone dysfunction that's caused compensation up here, and vice versa. People with low back pain often have a problem at their C1, where the neck is out of alignment. And so because of that spinal cord attachment at both ends, you're going to have these twisting compensations down the spine, which then pull on your nerves. And your nerves are all connected. You think about your arms and legs. If I pull my shirt at my arm, if I pull my shirt like this, you can see the middle line of my shirt is going to pull, right? So let's say you had an injury to your shoulder and your nerves in the brachial plexus are now pulling on your spine. The opposite side is going to pull back so that you can keep the spinal cord in the center. Everything about the way that your body compensates is how are we going to keep the vital organs, the most important organs, safe. So you may be compensating and having pains and things going on, but it's because you're actually protecting deeper structures. So, and this I see as well all the time, is the side that's painful is oftentimes not the problem side. So you might, this was the original old injury from like who knows when, maybe college or something. And this side is compensating. And you're like, oh, my right shoulder and my neck hurt. Everything hurts here. And then I check you and I'm like, actually, your whole left side is locked up. And I know all the massage therapists probably relate to this because I hear it all the time from my massage therapy friends. They're like, yeah, I keep telling all my clients that. But yeah, you really have to look at the whole and see how all those structures are connected. Yeah, are there any questions on that?
So, whoops, that's the wrong one. Your present. This is awesome. This is amazing. So one of the questions I did have with that was the concept between running and speed walking. Like I had heard before that running really wasn't that good for you for almost the reason
because
you
of
just
the
said.
organs. Yeah.
That is that true, or based on what
Well,
you just said?
So that's a loaded question. But I would say it depends on how you're running, if you're running correctly. I do running analysis, so that's something I treat a lot. And I used to be a terrible runner. I hated running. And it was because I was so hypermobile and weak that my joints were collapsing. So my hips, my glutes were weak. And when the glutes are weak, the knees tend to cave inwards and then the feet overpronate. And so as you're running, if you have no stability and you're pounding on the ground, all that impact is going to knock all your joints and cause pain. But if you learn how to run correctly and you stabilize your core and you have correct running form, then running is not bad for you. But if you're already running on a whole bunch of injuries and degeneration, then it can be.
Wow.
Yeah.
Amazing. I'll tell you, it's just overload.
Sorry,
But
it's a lot
no,
of
but it's so perfect
information.
because it's sort of like, I think you're right. And so Bev, we're all three on now, and it's sort of like what we've always talked about, the holistic approach. You just
Mhm.
which is
Yeah.
why we like BioTouch. But your work is awesome. Is there a place people can get hold of you if they have personal questions, or you go between
Yeah,
Tucson and where? Where's
Albuquerque.
your clinic?
Albuquerque.
Albuquerque. So how can people get
Yeah,
hold of you?
so I work at Balanced Physical Therapy in Albuquerque and Bernalillo. And I have a home office in Midtown. It's Sabaidee Physical Therapy. It's SABAIDEE Physical Therapy. But you can find me on Facebook at Dr. Tiffany Hodges. Um, I also do home visits for homebound patients. So, but those I have to schedule differently because I don't want to, be going back and forth.
Right.
Yeah.
So I try to put all my homebound patients that are in the same area, I drive to them back to back.
Right on.
Wow.
Well,
Yeah. Oh, and another note on the holistic care is that because all these different disciplines treat differently and they're treating different things, it's really great if you have a team that communicates so that people can know what the other person is doing, so everybody can work together to help.
Yeah. Yeah.
oh,
Wow. This was
thanks.
amazing information.
Yeah.
I mean, I think at least for me, I'm like, I had no idea. I
Right.
had no concept. But
Yeah.
I think what really came to me, Tiffany, was this thought of everything is connected. Everything works either together, or if something's out of balance, it affects other parts of ourselves. This idea
Right.
of holistic is really exciting. It really touched me. So
Yeah.
thank you so much. My
No
goodness.
problem.
All right. Well, we look forward to having you again. Whoops, sometime in the future, because every time you talk, it's like, oh my God, just
I know.
how little we know about our bodies. But and
Oh,
you have
yeah.
an incredible education and a great presentation. So,
Presentation.
Well, thank
Yeah.
you so much.
yeah.
Yeah.
I'm
All
like,
right.
sorry, I'm like throwing everything at you. I'm trying to
It's
get as
good.
much information in.
Yeah,
It's
it
good.
was perfect.
All
Thank
right.
you so
We'll see you
much.
around, and we're going to stick
Okay.
around and do teach some points. So thanks,
Yeah.
Tiffany.
Thanks,
Have a great
Tiffany.
night.
You
Yep. Bye
too.
bye.
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 Whew. All right, folks.
I know.
Awesome.
Wow. I was just I was just looking at my phone when we got back on because somebody had message and said, doggone it, I missed the first 15 minutes of this. I said, oh no, it's gonna be recorded and it's gonna be shown on our
Yeah.
Facebook page again.
Yeah,
So
it is recording. So
yeah.
we want to move right into how to do the points. Now, if you're
Yes.
out there and you want to follow along, you can download the PDF onto your computer while you're watching, and Bev's going to present the points. justtouch.com/workbook. And we are now going to show you sets of points that you can do to. When she talked about that back set,
Oh my
I mean, we
goodness.
touch at the tailbone.
Oh,
That's how I got involved. I had a huge
I
scoliosis. My shoulders were rounded. I was in my, late 20s, early 30s, and that sciatic nerve pain. And I'll have to tell you, BioTouch allowed my body to adjust itself without any manipulation. My shoulders started coming back. My hips changed. It was a little discomforting because everything was pulling just like
well,
she said, and things were going back
right.
to where they should have been. Now I see why I was in so
Now
much
you know there was
discomfort.
organs being
Right, right.
redistributed.
Hey man, this bladder belongs over here.
Wow. I actually was thinking about you and that story when she was talking about how everything was and what you went through and how BioTouch just helped the body on its own to
Right.
find its own way into a balance. Yeah. Without
So,
any manipulation,
yeah. So we'll
it's
talk a little
lovely.
more after the sets, but let's go
Yeah.
right to the sets, and I'm going to give it to you, Bev, while I scroll the sheets.
Okay. So are we going to go to the first set?
No, you're going to talk about the manual, and some people are
Okay.
here that
That's
don't know about
right. So for
BioTouch.
those of you who really are new to this, welcome. We're really happy to have you here. What we normally do is just go over a few basic points for you so you can just get an idea of the technique itself. So let me start out by saying that BioTouch, by definition, is one person touching another person lightly on the skin. And we're all having our own little dramas about that right now, but it's just an amazing light touch technique that is so powerful. So we touch specific points on the body. There's a whole technique with 17 sets of points. So, and literally addresses any condition the body can create of its own. And it just helps the body to naturally heal in its own time, in its own way. It's perfect. So there's a couple of bullet points that we always go over, which we will do. The first one is BioTouch is easy to learn. And we know that even children can learn it. It's so easy. And, the whole technique is set up in a program that is very, very, we do it in right now virtually in one day. When we used to offer the sessions in Tucson, it was 2 days, 8 hours, 10 hours, and you have the whole technique. So it's very easy to learn. The manual, the DVD is an amazing study tool to help you with that. We say children learn it. We've seen it. They become certified because it's kind of like BioTouch is part of us. It's innate in us to know how to touch another human being lovingly. And then we get to, be part of their healing. So yes, it's very easy to learn and to practice. The moment that you learn BioTouch and practice it with another human being, you are effective. That sounds crazy, but it's true. That is the most unique, one of the most unique things about this technique. You are immediately effective for somebody. BioTouch is a complement to any healthcare program. That means whether you're going to a massage therapist or an acupuncturist, or you're under a doctor's care, you're taking specific pharmaceuticals, or you're on a specific diet, anything that you're doing, BioTouch is only going to enhance. It's totally non-invasive, and it helps the body to assimilate everything quicker and better. So we say it's a complement, and really we're starting to understand how integrative BioTouch is with everything. And it is a holistic, as Tiffany pointed out, it's a holistic technique that takes into account all parts of ourselves. That's a whole nother story,
Right.
but it's amazing.
I just wanted to say, I just wanted to put in here,
Yeah.
one of the things that she talked about was the team, and how BioTouch, and as that compliment you were saying, could be part of that team. Yeah, we're doing
Yeah,
BioTouch, and to be part of the physical therapist, the doctor, including
exactly.
BioTouch into that team approach.
Yeah, we always encourage that, actually. If we're just saying BioTouch is another effective technique, and we always encourage all of our recipients to check in with your doctor, just use BioTouch with whatever you're doing. So that team is really important. Yeah, that was a good point she brought up. BioTouch has no levels of ability. This is one of the other amazing magical things about BioTouch. When you learn this technique, all you have to bring is those two fingers. There's no levels of belief systems or You don't have to go through all these levels of mastering this and then you move on to something else. It is the first time that you learn BioTouch is when you're effective, as we said before. There's no special training or knowledge other than just being given this technique that has not changed since it was first brought to the world. So this is, as we say, for every single one of us. There's no levels of ability. It breaks through all of that. So everybody's special in that. You can learn it and use it immediately. It requires no preparation time, a belief system, your state of mind. You don't have to go in and prepare the room or prepare yourself. If you think about it, lovingly touching another human being, why would we want to keep ourselves from entering into that relationship with another person? So, we're already inferring that, there's this negative thing going on. BioTouch, it just breaks through all of that. So these are the basic, things that we like to present with BioTouch, just for your overall information. And if you ever want to take it further, talk to us, because we can definitely take you a little bit deeper into the technique.
Yeah,
So
I think what
one of
people
the
need to
things,
I think what people need to understand too is this is just a workbook of our entire manual.
yes,
It's two sets, 2 or 3 sets of points of our entire manual. So that workbook again is at justtouch.com/workbook.
workbook. Yes. And the sets that we use for the back set is what we will present today, this evening's for you. So before we practice BioTouch, there are 1 or 2 things that we always do. We wash our hands, and BioTouch is taking the first 2 fingers of the hand and lightly touching and using like that butterfly touch, and holding each point 6 to 8 seconds. And that's it. Wash your hands, hold each point 6 to 8 seconds, very lightly like a butterfly, and you've got it. So let's go on. And if you're looking at our workbook, there's a language of BioTouch. We won't go into that tonight, but these are our specific language that we use in teaching BioTouch, just for a deeper comprehension of how we use those 2 fingers in touching on the body. So let's start with the greeting. The greeting is the key. It is always performed before addressing anything else for the recipient. And it just seems to open up this harmony. If you think of the relationship of healing that BioTouch brings 2 people into, it establishes a harmony between those 2 people. So we're going to go to the video, and we're going to see the greeting.
The greeting is always performed at the beginning of each session. It's the only set that uses one hand, and the only set that indicates which hand to use. The greeting is performed with the dominant hand. If you are right-handed, use your right hand. If you are left-handed, use your left hand. The greeting is made by touching at point 1, which is in the fleshy area just below the bottom of the breastbone or sternum. Hold this point for 6 to 8 seconds. Then with the same 2 fingers, touch point 2 on the back. To find point 2, look for the big bone at the base of the neck. From here, move 1 to 1.5 inches to the left. This is point 2. Hold this point for 6 to 8 seconds. More than one associate may work with a recipient, provided that all of the associates perform the greeting. If the associate or the recipient leaves the session, or if someone who hasn't done the greeting touches either the recipient or the associate, the greeting must be reestablished. Then the session may proceed from where it was interrupted.
Okay, so that's the greeting point. Always do that first. Okay, so let's move on to the second set of points that we can use for back pain, anywhere in the back, and it's called the metabolism set. And this is really a great set because it helps the body to open up, to assimilate what it needs and to eliminate what it does not need. And so let's watch the video on the metabolism set.
The metabolism set can be used to help the body assimilate what it needs and eliminate what it doesn't need. The metabolism set has 2 steps. Step 1 involves touching points in matching fire along the large muscles on the front of the neck. Points 1 and 1 are located above the collarbone in the soft indentations on both sides of the notch at the top of the breastbone. Points 2 and 2 are halfway up the neck on the front of the large muscles. Points 3 and 3 are at the top of the neck on the front of the large muscles. The second step involves holding a point on the front of the body and touching points next to the spine on the back. Hold point X on the front of the body is on a line directly between where the nipples would be on a youth and is 1 to 2 inches to the left of the breastbone. Another way to find X is 1/3 of the way up the breastbone from greeting point 1 and 1 to 2 inches to the left of the breastbone. The points on the back are located next to the spine, forming a rectangle around the breakover point. The breakover point is where the bottom of the rib cage joins the spine and can be found by imagining a line directly through the body from greeting point 1. To perform step 2, find hold point X on the front of the body and touch points 1 through 4 on the back. Point 1 is approximately 1 to 2 inches up from the breakover point on the left spine muscle. Point 2 is directly across from point 1 on the right spine muscle. Point 3 is 2 to 3 inches below the breakover point on the right spine muscle. Point 4 is used to address blood sugar problems and is added to the other metabolism points when needed. It is located across from point 3 on the left spine muscle.
Okay, yes, really great set.
So
now,
I just wanted to make sure people understand. One page is the little dots on a picture, but then on the following page, there's always a description in words, and I'm showing it up here now, that
right.
Explains exactly where those points are. So you have,
Yep.
and there's a link on this ebook to that video. So between the written word and watching it and hearing it, there's really no way that you can mess up.
Cannot learn this.
Right.
Right. So let's move on to the back set itself. Boy, I can't say enough about this. I think, Paul, maybe at the end, you and I can go into a little bit of what she was talking about in terms of the organs and all of the nerves. Yeah. So the back set itself is, of course, to be used for any pain in the back. And it's a great set. So let's
including
go.
alignment. So the pains in the back for alignments, pelvic
Yes.
tilts. She talked about the tailbone.
The tailbone.
Yeah, all those things. It can help structurally, muscularly, neurologically. So
it's amazing. Okay.
The back has 5 steps. Step 1. With the index and middle finger of one hand, touch on the end of the tailbone indicated as X in the manual. At the same time, spread the first 2 fingers and the thumb of the other hand to touch points 1 and 1, which are located along the side of the muscle on both sides of the neck at the base of the skull. Step 2. While still holding X, move the first two fingers of the other hand to point 2, which is at the center of the neck at the base of the skull. Step 3 involves touching around the sacrum region of the lower back. This area is identified by a triangle formed by the tailbone and two dimples located just below the normal belt line. With the two fingers of one hand, hold T, which is in the center of the triangle. While holding T, use the two fingers of the other hand to touch points 3 through 9. Point 3 is on the spine above the triangle. Point 4 is at the outside corner of the dimple. Point 5 is at the outside corner of the other dimple. Point 6 is next to the tailbone. Be careful not to perform a misfire here by crossing your hands. Just switch your whole hand and continue. Point 7 is across from 6 on the other side of the tailbone. Point 8 is in line with point T and is on the side of the hip. Point 9 is on the side of the other hip, again in line with T. After you've completed step 3, it's a good time to add local work or enhancements to specific areas of the back. These areas may be determined in several ways. First, local work can be added wherever a recipient has a specific problem in any area of the spine. For example, if the recipient has low back pain, the associate may apply local work in that area. Local work includes any combination of matching fire, sweeps, or hold points. Also, local work may be applied in an area of the spine that relates to a specific condition in other areas of the body. For example, if the recipient has a heart problem, the associate would touch in the area of the spine that is the source of the nerves that relate to the heart. An associate may also look for a subtle marking on the skin to help determine where to do local work. These markings might include moles or mole patterns, changes in skin color, or changes in skin texture. After completing any local work, move on to step 4. Begin at points 10 and 10 on both sides of the tailbone. In matching fire, touch points 10 through 17 using the top of the large muscles on both sides of the spine as a guide. These points are located at approximately every other vertebrae and may also be gauged by moving the hands up the spine the same distance as the hands are apart. Be sure to take your time in performing this step and hold each set of points for 6 to 8 seconds. Once you reach the points alongside the big bone at the base of the neck, begin step 5 by slowly sweeping all the way down both sides of the spinal column along the top of the large muscles. At points 10 and 10 next to the tailbone, gently curve outward to the hips and lift the fingers off the body.
Well, there you have it. Those are the basic sets that can begin to address anything going on in the back. Helps the body.
And on this page I'm showing here, page 15, is a synopsis of what you just saw.
Mm-hmm.
But again, each step is defined exactly where those points are in the pages preceding that. So
right.
that is amazing. We had a question. Casey's asking us, how does this compare or differ from lymphatic drainage techniques?
Oh,
Yes. So, Casey, I don't know a lot about lymphatic. I've talked to people who've done it. I think the
yeah.
key is BioTouch on its own, from what I've seen over 30 years of doing this now, helps the lymphatic system clean itself out. But when you saw in that video where they're doing local work, then those people who know lymphatic drainage and know where the lymph nodes are and know how to get that stuff moving, you could, just with that light touch, do some matching fires, do some sweepings in that lymph system, go follow the lymph system if you want. So you can use what you know and
Right.
still use that light touch, and it will still help in that lymphatic drainage. So,
Well, the also that metabolism set
yeah,
is really effective for getting rid of, helping the body to get rid of fluids that it doesn't want.
yeah.
So yeah,
Get rid
that's
of
a
the
great set to
poisons and
use.
all the other
Yeah,
stuff that's in it. So just
absolutely.
those two sets, like Tiffany was saying, a lot of times in those muscles there could be poisons and even trauma stuff. When she talked
Right.
about trauma, that our
Oh yeah.
body is holding trauma, BioTouch is just so awesome for that because it's just a loving touch. You're not trying to change people. You're not trying to improve them. You're just meeting them in their pain, which is meeting them in their fear, and it's meeting them in whatever situation they're in. And you're saying, we just want to touch. We just want
Yeah.
to help your body guide itself to a healing process.
Yeah, I think that's a really good point right there. BioTouch is the tool that is given so the body can do what it does best, and that is it already knows what it's a intelligent unit, holistic unit, and it knows what it wants. It wants to be healthy and in balance. So BioTouch just lets the body do its thing. It really does. It's without any manipulation, without us saying, I'm going to do this. Just touch those points and
Yeah.
you've got it. Yep.
So we are here to help you learn BioTouch and do it in your practice. If you're a massage therapist with us today, we encourage you to take our full training. It's an 8-hour training. It's 7 hours, 7.5 hours to get 8 CE credits, and we go through the whole manual. You
Right.
get a PDF version of the entire manual with the links to the DVD. But we can also just answer personal questions. Now that you've learned a little bit about BioTouch, it's easy for us to do this through a Zoom, through a virtual training, over the telephone. That's how easy it is.
Right.
We haven't talked a lot about the history, and we don't in these workshops. But if you're interested in that, this month until the first of the year, we're selling the book BioTouch: Healing with the Power in Our Fingertips, which is a story of how I met the man who created the system over
Right.
30 years ago now,
Yeah.
and Deborah Schildhouse, who wrote the book. And it's sort of a play on her journey in getting into BioTouch and my journey on how I met the man and have dedicated my life to getting BioTouch out there.
Yep.
Bev here is the president of the organization, and we have a great board. And our goal really is to be of service, is to
Yep.
get this into every family and home out there. So whatever we can do, we're here for you.
We're here. Yep. We are.
So let's see if there's any other questions. Casey, BioTouch seems like a great tool to enhance multiple techniques. I was thinking of this as a separate modality on its own, but that makes a lot of sense. Thank you. And thank you for joining us. And that's a great perception. BioTouch, it just works with everything. For you massage therapists, I'll tell you, we've had incorporating this into your massage and any other work you do, it'll make your job half as difficult. Guaranteed. The body just sort of melts.
Just opens up.
Yeah. So again, let us know how we can help you. And another marvelous workshop, huh, Beth?
Yep, it was great, and thank all of you for joining us this evening. I hope hope to see you again.
And this will be posted on our Facebook. We'll also be sending out an email. Please send it to whoever you want. The more people that get it, the more people that start practicing it, the better off we will be as a humanity.
Yes, indeed.
All right. Blessings to you all. Take care.
Thank you, everybody.